Affinity Empowerment Chief Behavioral Health Officer and Chief Operating Officer Dr. Michael Tkach grew up reading Sherlock Holmes and sniffing out the perpetrator of an ice shack arson. By now, he's graduated to studying the linkage between inflammation and depression while pioneering a streamlined and powerful approach to pool testing for COVID 19. Two swabs, anyone? In this episode of the HealthBiz podcast, Michael shares insights on using the psychology of the news media to understand human behavior during the pandemic and tells us whether Affinity is a tech company in healthcare or a health company in tech. I'm your host, David Williams, president of Health Business Group. Well, Dr. Michael Tkach, Chief Operating Officer and Chief Behavioral Officer of Affinity Empowering, welcome to the Health Biz Podcast.
Thank you very much for having me. I appreciate being here.
Michael, we're going to talk about the current day and the future, but I want to rewind the clock a little bit and ask about your childhood and your early influences. What was your upbringing like?
So I grew up in a northeast suburb of Minneapolis, Minnesota. And as a child, I loved reading mystery books like Sherlock Holmes and everything else. And at the time, there was, this is around third, fourth grade, there was an individual walking around or going around setting fires in the neighborhood. And they ended up burning down like the local ice skating rink warming house. And I remember just going through and digging through the ashes, thinking, okay, I'm going to figure out the clues, put this together, and kind of having this idea that through the way that people behave and they act, you could construct this idea of who somebody was. And that idea just fascinated and captivated me. And from there, being in a large family, my parents were, on my dad's side, were third generation Czech Russian immigrants and whatnot. There was always a strong emphasis on business and figuring out what you can do with that. I was kind of the odd one out where I was thinking like, okay, I want to go into psychology and start figuring out how to piece puzzle pieces together and figure out who people are and how things work. And to me, it just felt like it was a key that unlocked the understanding of so many different things. And so it just captivated and fascinated me. So started pivoting from there to start reading Jung at like kind of a young age and Freud and all those other things to kind of get in there and start exploring psychology.
No, it's interesting. And it's a very northern Minnesota kind of thing to do, to burn down a warming house of a skating rink. I mean, what the heck? What kind of psycho is up there doing that type of thing? I wonder what they'd be doing. Somebody like that who lives in Florida, I wonder what they'd be doing.
They don't have the options. So
No, that's good. So you've got a background after that, really, in mental health and addiction recovery, and you did go over now. Now you're in a more business oriented thing. So I don't know if your family now feels like you're part of it or not. But what is that kind of early part of the career been like, and why have you kind of moved over toward the more business oriented position that you have now?
Good question. So I actually started with the idea of understanding of wanting to go into psychology and figuring out like how I could help people and how I could really relate to people in that way, and that kind of capacity of doing mental health and providing those services. One of the things that I kept in mind, a lot of it was the influence of my family, was could I do private practice and run my own business that way? So I always kept an eye on the business end of it. Before getting into grad school and kind of while doing undergrad and everything else, I worked operations at places like Target and Wells Fargo, and really was in the business side there with the understanding that eventually I was going to go do a private practice. Now, getting to grad school and learning about healthcare reimbursement and everything else and the way that it was the market for private practices at that point, as well as just getting very interested in substance use and thinking about systemically how healthcare is shaped, kind of drove me away from the private practice idea. And what happened was I went in and started doing my private practice, really loved it, but thought about like, how can I go ahead and expand my level of influence to really help think about the way that people approach the system of healthcare. And that became kind of like a thing that was really fascinating to me, is how do we engage in healthcare and where things were kind of legacy and things that had just, we do this because it's the way it's always been done, versus yeah, if we really throw it out and say, let's think creatively outside of the box, what could be done instead? And so I went from doing direct clinical work to moving into a position where it's like, okay, let me go into teaching, because then I can start having an influence on the next generation of clinicians. And then from there, it kind of expanded to where I went into director positions over at Hazleton Betty Ford, where I was running one of their divisions there. And then from there over to Affinity, where I quickly became chief operating officer and chief behavioral health officer to help
Yeah.
expand that influence. So,
It's I saw your title and I saw CBO, and I'm trying to figure out. I figure out somehow like chief business officer, but in this case, it's chief behavioral health officer. They sort of snuck the H in there without
right.
without giving an extra. It has to be a TLA, 3-letter acronym.
I was going
Otherwise,
to say, everybody likes it short and succinct.
yeah,
So,
yeah. No, that's good. Now, interesting, another name now, this Affinity. Now, it's Affinity Empowering. Those are both kind of interesting and uplifting words. What's the background on Affinity Empowering?
so the naming of the company really predates my time at the company. But what I really look at that and how I take that name and I really try to run with it and I give direction to my team and the people that are in our different divisions is that we really want to empower people in their navigation of the healthcare system. So when somebody enters into health and they're thinking about their own wellness and well-being, I really want to think, how can we empower them to be able to make the best decisions for themselves possible? How do we help navigate this? How do we make technology so that healthcare can come to them in the homes rather than being something that is happening in this foreign place where they go, because it builds anxiety. You're not used to going to a hospital. You go to a hospital, you always associate it with, oh, this is when crisis happens or when there's negative health things. And there's that normal level of anxiety that most people feel because it's a stressful situation, because it's out of the norm. And what if we change the way people relate to their healthcare and instead say, okay, can we reduce that anxiety by putting it in a familiar setting? Can we bring it to the house? Can we bring it into their day-to-day engagement and touch points? Can we really empower them to make them feel like they can be invested in their health the same way that we're trying to empower people with online banking to be invested in their banking and their financings, and remove the scary parts of it and make it more accessible and easy to navigate? And so I really try to encourage my team to run with that idea of how do we empower people just to feel like they can handle this.
Now, it was hard enough, I think, probably, before the pandemic struck. But what's it been like, during the pandemic? How did that shift things? Because it sounds like the ideas that you had, those concepts, they do fit for any time. That was already kind of a trend, but clearly, some things changed over the past year and a half or so.
Absolutely. We were actually uniquely positioned for when the pandemic hit, because we have at our base, we're a technology company that addresses healthcare. So we're a healthcare company that has a strong technology backbone to it, or we're a company that does healthcare. You can kind of look at it either way. And one of the things that we had always had as a driving value is to really say, how can we use technology to bring healthcare to people? So even prior to the pandemic, our online platform and our technology platform that allowed people to connect was really established. The way that I've always looked at it is it's a way to remove barriers to access. So people that are in more remote areas can get the same level of care and engagement as somebody that's in a more urban area that's highly concentrated, because you can collapse that distance through use of technology. And we've really seen people latch onto that with the pandemic. Prior to the pandemic, this idea was kind of, technology and using virtual and visits and those types of things. That's great, and that's for the tech savvy people. And some people will go ahead and like it, but everybody loves the in-person thing. And what this pandemic really did was it forced people to get out of their comfort zone and actually say, okay, let's actually test it out. Let's make it more widespread and available. And let's see, do people latch onto it? And I think things like Netflix and all of these virtual streaming devices and things that got people more used to using technology to tap into things and really make choices and engage, and the kind of the proliferation of iPhones and Androids and all these other types of things where you can have the computer right there in your hand with you, helps really prime it so that once this pandemic hit, that idea of shifting to be more technology based and mobile and being able to bring it to you became just a natural progression rather than a hard pivot or your paradigm shift. And so, we've really seen a lot more interest and a lot more investment and engagement in terms of people saying, okay, this is how I want to engage in healthcare.
So certainly, those of us who have been active in digital health, formerly called, e-health or whatever, over the past couple of decades, was just amazed and shocked to see in like 1 or 2 weeks in March, things were about 10 years of progress. And then it's interesting to see what happens, when things are sort of, back to normal. So on the one hand, you go out now and people sort of, ripped off their masks, acting more or less normally. What's happening in terms of the workforce? How are people kind of coming back to work? How are they taking some of those things that they embraced maybe as a matter of not as choice but by necessity during the pandemic? I mean, how are those changing, and what's the role kind of on the provider side? Because to empower the patient or the consumer, you need to also have the providers sometimes change as well.
Absolutely. I mean, that's a really good question. So, what we saw with the pandemic, and really when we started looking at things like COVID testing, which our company does, where we would set up COVID testing for people trying to return to normalcy with their workforce, we saw a wide range of responses to that. Some people were very eager to say, okay, let's set something up, let's create a safe environment. People are worried about the pandemic. We'll go ahead and we'll do surveillance screening and we'll just test, or not even surveillance, but diagnostic, and really just do at point of entry and then serial testing after that to make sure that we keep an eye on it, to make sure if all of a sudden there is a positive, we can react quickly. And then we saw other places that took more of a reactionary approach. If somebody tests positive or goes out sick, at that point we'll do some testing. And then once that's determined, we'll lay back down and or kind of revert back to where we were before and just kind of deal with it as it happens. And what we ended up seeing was that places that were doing more of the serial testing to be proactive were really able to manage their positivity rates, typically keep it below 1%, even when times where positivity rates were going much higher. But it created this different type of atmosphere within the workforce. And one of the things that we started when we're working with companies that we started kind of ringing the bell about and saying, hey, we should keep an eye out for this, is that people get pandemic fatigue. Whenever you have a new behavior like this, where it's like masks and social distancing and whatnot, people want to return to normalcy. They want to go ahead and relax and feel like, okay, pandemic's over. Let's go ahead and go back to life the way that it was before. And so when it's new, people tend to follow the rules. There may be some people that are reluctant to jump on and do some of the safety behaviors. But over time, as people say, okay, we're managing this well, our positivity rates haven't been there, it feels like the threat is distance. And then you get places that start relaxing. Now, what we're seeing from the workforce, though, is that now it becomes a question of here we are, we have kind of a unique situation where overall positivity rates are down. We've got the Delta variant where things are going up. We have the vaccines, and there's questions about efficacies in different areas with different variants. And we've got a bunch of people that are looking for life to be back to the way it was prior to the pandemic. And they want to reset the clock. And so employers are really looking all over the map about what to do. Schools are doing the same thing, and everybody's looking for some guidance. And one of the things that we're really working with places to think about is that it's a paradigm shift in the way that we think about testing and we think about safety precautions. For instance, if somebody has diabetes, they're going to continue to monitor their insulin levels. And even if they're monitoring it and things are going well, they don't stop testing their glucose levels. They don't stop doing those tests. They figure it out so that they can respond and react and do according appropriate actions. And so it's really taking that type of a shift in perspective. But you've got some workers that are saying, you know what, I want to stay home. I want to do remote. Like, this was great. I proved my job can do this. You've got some employers that are saying, nope, we work better when we're all together. So we need to figure out a solution so everybody can come back in and feel safe. And you've got this mix of people that are somewhere in the middle looking for some type of direction. And so it's been a really interesting paradigm shift and really seeing what's happening in the world right now and how everybody's responding to it, because people want as much normalcy as possible, but they also want to be safe. And they also want to make sure that they can go ahead and reduce their anxiety about it. And so it's driving towards a bunch of different means or different
Yeah,
means.
no, it is interesting because it's not so simple. And not that diabetes is simple, but to use your
No.
example there, you get your diabetes under control, you continue to you continue to test your blood sugar and have your other kind of preventive measures along the way. But with COVID, there's some people that, have gotten the vaccine and there's some that haven't. So it would be like with somebody with diabetes, somebody that sort of has a functional cure, let's say, versus somebody who's still kind of uncontrolled. And then you've got the difference between, this isn't the right analogy either, but somebody's going to stay home. Well, maybe there's somebody who's going to isolate themselves, and now maybe it's like somebody has totally changed their diet with diabetes, and now they can act in a different way, or they have a new medication. So there's all sorts of things, and I think it's just not clear. And it's also everybody got it at once.
Yep,
Everybody was facing the same threat at once
exactly.
all around the world.
Absolutely, and I think that's where it creates this thing where there's a spotlight on there, and a lot of people are looking for media or some other places to get their information from to say, okay, what do I do? And what we kind of know with the way that the brain processes information is we look for salience. So we have a part of our brain, the reticulating activating system, that goes ahead and starts filtering out things that are more mundane, that aren't a threat or aren't a reward. And so once things become more normalized, we don't focus on them as much. So when you start looking at 24-hour news and everything else, in order to keep attention, typically we've set up the situation where we need something that's either really good or really bad.
Yeah,
And kind of the gray area,
preferably really bad, right?
because scare tactics tend to create short-term change and
Yeah,
change behaviors and viewership and everything else. And you see that. And when it's kind of more like, let's give you just fact-based in the middle, it's easier for people to just dismiss it and say, okay, that's nice, but let's hear like the real thing. And what you're starting to see now is there's also occasionally times where if it seems a little more balanced, people are like, okay, what aren't they telling us? And it's because we're used to the more sensationalized parts of it. We've created this system that kind of goes out there and says, okay, let's give us the things that are going to grab the attention. And when that happens, when we start thinking about like, okay, what's a balanced approach to addressing COVID and creating a step forward to return towards normalcy, you run into some barriers because sometimes people are like, well, it can be that simple that we're just doing testing and following the same rules, and we do that, and we look at what we're doing with with the vaccine, and we just come up with a safety plan where everybody's like, okay, where's the catch though, and what do we do, and what's the stuff, and it really, you can find these simpler approaches that help manage it, that aren't as invasive and gives you kind of that sense of normalcy. But in a lot of ways, with this pandemic and the fact that it's not over, the idea of going completely back to normal and saying, okay, we can just forget all of this, for most people, that's not a luxury that we have, because there is always that risk, or people that can't qualify for vaccines, they have immune compromise, or for whatever reason they can't take it. Vaccines, and with questions of efficacy and how long it lasts and how effective it is towards the different variants, there's still stuff that needs to be done to help keep people safe and give people that ease of access. So to empower them and really give them that sense of like, how do you get back to as close to normal as possible? It's like, well, we just need to provide the right tools and the right screening mechanisms and the right things so that we can make informed decisions. It's kind of like, let's take the blindfold off and let's just look at the data so that we can make those decisions. And it might not be as exciting or, attention grabbing at the either ends, but at least it gives us the information so that we can do what we need to.
it's helpful, I think, to have the behavioral lens on what's going on, because there's the whole context of the society as well. And you notice, talking about the news cycle, and I've been hearing, as I've been out in public more, hearing people talk about the vaccine, and people that I never really thought had any interest or authority or knowledge about like the clinical development process, all of a sudden seem to have a view about it that is authoritative in some way. So it's, and you have to understand that people are going to come from there and start talking about it. Yeah, but that's the way the brain works, I guess.
Right. You get a little piece of information, and then we love to construct stories. And so part of what I got into with my dissertation and everything else in school was looking at metaphor construction, semiotics, and how we take language and ideas and we go ahead and construct narratives with it. And we love taking little bits of information. Our brain is set up because you can't ever really take in all the information out there. We have to put the puzzle pieces together. And a lot of times we do that in very creative ways. When we start thinking about how we construct a story, you have limited information and you're filling in the gaps. And we use it, and we know this in storytelling because we have foreshadowing and everything else where it's playing off of that tendency. But when you start thinking about news and people trying to make decisions about their lives, when you add fear to it, so I don't know what to do, with COVID, I don't know what to do with the pandemic, and then you give a little piece of information, it feels like the stakes are high for somebody to connect the dots and create this narrative. And so there tends to be more cognitive pressure that may be subconscious or unconscious that's kind of jumping to it to push somebody to say, okay, now I need to create a story. And the moment I feel more in control of that story, like if I feel like an expert, the less stress I'm going to have about it because I can be confident in my convictions and think, well, I've got the solution. And often that happens with us filling in the gaps rather than us getting the complete story.
Got it. So I got a couple of questions about what we'll see here over the summer and then into the school year. So first on the summer, so I noticed where I live in Massachusetts now, there's this lottery, and I don't usually play the lottery in Massachusetts, but I have something that I got that said I can sign up and I could win $1 million because I'm vaccinated, and there's multiple drawings. And if you're a kid, you don't win $1 million, but you could win a $300,000 scholarship, which would, by the way, almost cover the cost of a private college in Massachusetts, but not quite. That's a different podcast. So is any impact of that? I mean, other than giving away a few $1 million, is that going to help anything?
So there's a couple of different things that happen here when people do these types of reward programs. This is that salience thing that we just talked about, where it's if somebody suddenly is vaccinated and they get $1 million, it's basically like that's a rich reward for doing this. If I was on the fence about getting vaccinated, that'll push me over because $1 million for most people would dramatically change their lives. And so that's that kind of push to say, okay, let's go ahead and do it because who knows what might happen. And if somebody is kind of on the fence about it, that could be enough to change somebody's motivation. And when we think about like different needs and how people need to protect themselves and take care of themselves and provide for things like rent or mortgages and food and stuff like that, doing something simple like getting vaccinated, which they can often do in most places for free or covered by their insurance, can be a real drive to do that. So those types of tactics tend to work to a certain extent with a certain group of population when they're imposed. So you might see people, you probably will see quite a few people that were on the fence that were kind of more neutral about it, saying, okay, that could be a drive to go. When things like that happen with kind of what we look at from history in psychology, if somebody is dramatically opposed to it, the $1 million most likely won't change that person's mind to say, okay, I was dramatically opposed to it, but because there's that potential reward, I'm going to go ahead and do it. And what happens there is if it's a smaller, and then when we actually look at changing behavior, a lot of times smaller rewards actually do a little bit better because now what happens is you've done this. And if you don't win the lottery, it's not like, well, I did this because of the chance that I could do $1 million. It's like I did this and I got, a coupon for a free X, Y, or Z. You can say, well, even if I don't use that coupon, that wasn't enough to really convince me. I did it because I wanted to, and I feel good about this. Whereas if it's that risk of I could win $1 million or not, once that $1 million is given out, it kind of removes all motivation for other people to go ahead and continue with that behavior, saying, let's go ahead and get vaccinated. But at this point, I think the drive is so much to say, how do we get as many people vaccinated and safe as possible, that even that initial push to get somebody vaccinated overall from a public health point of view probably outweighs any of the negative risks with it. But
I think they're actually doing, to partly address your point, I think they're doing a series of $1 million drawings, one a month for the next few months.
okay.
So that they
Yeah.
have something. Hey, I missed out on the first one, but Joe Bob got one. He got his million, and I'll take mine.
Well, and definitely if you can go ahead and they can, and I'm sure if something like that highlights who won and that it's a normal person that's just like me, just won this $1 million, that tends to be a great motivating factor. Media and advertising use that all the time, saying, okay, look at what happened to this person. They're just like you. It could be you next. And so there you go.
So let's talk about back to school. Last summer, I remember we were talking about back to school, and it really wasn't. But now that we've had another year of this under our belts or so. I know that you've partnered with a lab company, I think Eurofins, and are looking at doing expanded, testing to get people back to school and in the communities. What's that about, and how is that working? How's it going to work as we look at the school year?
Yeah, so Operation Expanded Testing was created in combination between the Department of Defense and Department of Health and Human Services. And what they did is they went ahead and looked at the US in terms of 4 separate regions. So we are working with Clinical Enterprise, which is a Eurofins company, and and that partnership, we are in agreement with the United States Department of Health and Human Services to do the Northeast and the South regions. And so, what this program does is it's money that's earmarked to help expand testing and remove barriers to access, and so that places can get going in testing. So, one of the things that how this works is that let's say you have a school with some of the other funding options out there. The school might otherwise need to put up the money first, go through, do testing, submit for reimbursement. There's a lot of paperwork and there's other stuff to go. Wonderful programs and great ways to go ahead and engage in testing. What they wanted to do with Operation Expanded Testing is change that dynamic so it's easier for people to engage. So with this, it's really as close, it's click and go. Somebody can go ahead and sign up, and if they're the decision maker and saying, okay, I want my school to be enrolled and involved with this, they can go on the website, click go, and we contact them and help set it up and establish testing. Otherwise, they can work directly with one of our representatives and get this set up. And the funding happens between the lab actually working with the government directly. So the school's not putting up the money and then waiting for reimbursement or anything like that. It really creates a really smooth system where it removes those barriers to care so that people can get up and going and get tested. And we're really looking, at setting up how we're running it is that we're doing a high ratio pool testing. So it's 4-to-1 so that we can get a large number of people tested. We have more than enough lab capacity to handle all of that and supply chain capacity to handle all of that. We work with the schools. We have our trainers set up to go ahead and help support schools and other congregate settings, so like shelters or nonprofit organizations that qualify. To get set up and get tested. And we help run the couriers and everything else to get the samples from the place that they're being tested to the lab. And then the lab goes ahead and processes at those. And what happens is most results happen within 24 hours if they need to immediately reflex. So for instance, a pool pops positive. What had happened is while we're doing that collection, people are taking 2 swabs at once. So that first swab goes into the pool. And if the whole pool is negative or presumed negative, then that's it. It's all done. If that tube of 24, if we detect a positive in that, they immediately take that second swab that's tied to that unique individual and run it so that they can immediately tell who in that pool is being indicated as having a positive presence for COVID-19, and we're able to immediately do that and get then those results within typically 36 hours or so or less. So for right now, the program's averaging about an 18-hour turnaround time, but we tell people 24 to 36 hours is typically what to expect. And then you have that information so that you can make good decisions about what to do with your school.
I hadn't heard about the second swab approach. Maybe others are using that as well, but it seems the bottleneck that you're trying to solve for is actually running the test, not taking a swab. What you're doing, that's just another quick swab if you're doing a second one, so you can have that on hand and keep the sample around for a day or two.
Absolutely. And that's the thing that when pooling first came out, one of the things that people were looking at, first of all, they couldn't do the high ratio. So a lot of pools were 5-to-1 or whatnot. And I was really trying to say, how do we solve for the fact that we don't have a lot of lab capacity to run these tests? Well, things have changed dramatically since when COVID first came out, and a lot of labs dramatically increased their capacity. But at a 5-to-1 or kind of a low ratio, it doesn't add as much capacity or as much time. And one of the barriers that people have been running into is that once a pool was positive, typically what had been the historical way that people approach this would to say, okay, now we need to schedule a follow-up individual test for those 5 individuals. And so you've got all the time delays that go along with that. What a clinical enterprise Eurofins has solved for, and what we're working with them and administering these tests for, is that immediate reflex capability, so that people aren't waiting around that extra time of setting things through logistics or waiting for things to be delivered. It's seamless. And then for the individual that may be positive, they're not getting pulled aside and asked to submit a second test and then let's wait for the results and whatnot. They just get that all as soon as they're available from the lab.
Great.
Yeah.
So, Michael, we started off this interview talking about childhood and reading Sherlock Holmes and so on. And are you still reading that, or do you have any newer recommendations for books?
No, so what I'm reading now is The Inflamed Mind by Edward Bullmore. And so what it really looks at is a different way of conceptualizing depression, and ties to biomarkers with inflammation. And one of the things that I think is great about this book, and there's just a whole movement out there right now with research, is really looking at how mental health related symptoms are tied to physical symptoms and different ways that we can actually do different types of tests and diagnostics to go ahead and better, more accurately diagnose what's going on with mental health. For a long time, there had been this idea of separating kind of what's going on in the mind and what's going on in the body, and realizing that they're kind of linked to some degree, but not fully understanding it. And with advances in technology and people willing to think outside the box and really say, okay, let's move away from those legacy approaches to mental health and instead say, let's look at creatively, what do we know and how do we actually tie all these pieces together? We're really seeing how psychologically and physiologically there's this reflexive system with the way that our body is responding to things will affect our thoughts and our perceptions of things, and the way that we perceive and understand things will affect the way that our body responds. And if we can understand those connections and correlations, we can more accurately diagnose and better treat and give people just overall better outcomes and empowerment by letting them know what they're doing and what's going on with them.
Great. Well, on the next podcast, we'll have to talk about how you apply that. You could give them an extra swab for the diagnosis along
With other
along that direction.
services.
Yeah. Well, great.
Absolutely.
Well, Dr. Michael Tkach, Chief Operating Officer and Chief Behavioral Health Officer of Affinity Empowerment.
It has been my pleasure. Thank you so much for having me.
You've been listening to the HealthBiz podcast with me, David Williams, President of Health Business Group. I conduct in-depth interviews with leaders in healthcare business and policy. If you like what you hear, go ahead and subscribe on your favorite service. While you're at it, go ahead and subscribe on your second and third favorite services as well. There's more good stuff to come, and you won't want to miss an episode. If your organization is seeking strategy consulting services in healthcare, check out our website, healthbusinessgroup.com.